this morning, Jai Hind and I had a very interesting talk. Okay, there we go. Welcome, everybody. It is great to have you here, and it's great to be with Dr. Hariprasad, who looks after the Apollo Group. And in these times of COVID and post-COVID, it is important to find out what a medical administrator, doctor, and one who looks after 72 hospitals at the same time has to say about healthcare post-COVID. But before I talk about Dr. Hariprasad, I leave that job to my partner here, Himanshu Rai. But before that, I just need to make two announcements. First, we owe thanks to 92.7 Big FM, because they have promoted us, and to Money Life magazine, which has also been one of our promoters. The second announcement I want to make is next week we'll have Dr. Hiranandani, who is the president of NAREDCO, one of the largest construction consortiums. And he's also the president of ASSOCHAM, because construction is badly hit. And being the president of ASSOCHAM, he'll have a view to say. And then a week after that, we have a surprise, which I'm not going to talk about now. Okay? But Himanshu, will you do me the favor of introducing our speaker for the day?
Yeah, thank you very much, Bhaskar. And a very good afternoon to all our viewers. I hope you all are staying home. Even if you're at work, you are staying safe and you're taking very good care of yourself and the people around you. It's a privilege and a pleasure that we have with us Dr. Hariprasad, the president of Apollo Group Hospitals. Dr. Hariprasad is an educationist. He himself is a doctor with an MBBS, MD in anesthesiology, FCM, and an FIFM. He worked from 1992 to 1997 as a consultant in anesthesiology and critical care in Sri Devi Hospitals, Hyderabad. And thereafter, in 1999, he joined Apollo Hospitals as consultant in anesthesiology and critical care and grew to become the group president in 2015. He's the convener of Healthcare Group CII-AP 2007 and 8. He was the first individual outside Europe to be awarded Fellow of College of Emergency Medicine in UK. And he has also authored a book called I Am Possible. A very warm welcome to you, Dr. Hariprasad. And before we actually, Bhaskar and I start bombarding you with questions, and there are lots of questions coming in from our viewers as well, what are your thoughts on the current condition in healthcare in India?
Okay, thank you so much, Himanshu, and thank you for the good words. And it's a privilege to be on this platform. And I guess this is going to become the new normal, meeting on platforms like this when we can't really meet physically. Well, coming back to the situation, epidemics are not new. From time immemorial, we've had epidemics. Those with gray hair would remember cholera, plague, and Spanish flu, and the younger generation would definitely remember HIV, AIDS, and swine flu, and SARS, and Ebola, and stuff like that. So we do remember a lot of epidemics over the centuries, but what we don't realize is that each of the epidemics have left behind a huge impact on the world on multiple fronts, on geopolitical, geosocial, socio-economic fronts. So there have been multiple impacts of these epidemics. If you go back to the 19th century when Napoleon Bonaparte was marching and trying to conquer the world, he had to stop. And what stopped him was an epidemic. On the east, it was yellow fever. On the west, it was typhus. So he just couldn't move. And the world was saved because of an epidemic at that point of time. If you take the 20th century, I'm sure all of us know about HIV/AIDS now, and it created a huge change in the sexual behavior. At least it demanded a huge change in the sexual behavior of a human being. And that's the change that it brought about in the 20th century. Now coming to the current century, COVID is going to be a huge difference. It's going to create a new normal. It's going to change the way we live. It's going to change the world. It's going to have an impact on almost every aspect of our living, whether it's travel, whether it's eating, whether it's speaking, whether it's gathering, whether it's a get together. We're going to have it to change in a big way. One thing we'll all have to remember is over the years, none of the viruses which caused epidemics have been eradicated except smallpox and polio. So COVID is not going to go anywhere. If somebody is sitting at home expecting COVID to disappear and then to come out, then they would be sitting at home for the rest of their lives. So first thing which all of us need to realize and understand is COVID is here to stay. And the only way is to protect ourselves till the vaccine comes in and a definitive cure for a definitive antiviral drug for COVID comes in. It's to stay safe and to follow all the precautions that need to be taken. So as I said, COVID is going to have a lasting socio-economic impact on the world. The first change is going to be the behavioral changes for the individuals and the people living in the communities. We've been taught all this right since our childhood, but we never paid importance to it. But now COVID is going to make us pay importance to it, and we better follow that. Hand hygiene, we've always been told about it. Cough etiquette, we've always been taught about it. Social distancing and wearing a mask. These four are going to be the behavioral changes which COVID is going to put into the system. And we better learn to live with this new normal. If we don't, then be ready to welcome the COVID virus into your houses and into yourselves as an individual. We're going to travel less and going to use more of such digital platforms. We're going to have less of physical transactions and more of digital transactions. And there's going to be a huge economic impact on the world. Not just because of the virus, but the way we are responding to the virus. In India, the lockdown is a great example of the economic impact that it has had, the response to the virus has had on the economy of the country. And it will take quite a few years to come back and recover from that impact which it has had and is having, and probably will have a bigger impact in the future. Now, coming back to healthcare, whether somebody likes it or not, 80 to 90% of healthcare in India is provided by the private sector. And when I say private sector, it is not the large groups like us. It's not the large hospitals. Large hospitals actually provide less than 5% of the total healthcare. Oh. It is that single doctor who sits in his clinic in the periphery. It is that small nursing home of 5 beds or 10 beds, which provides almost 80 to 90% of the private healthcare in the country. And sadly, this is the sector which has been hit the most. The doctors who are not sitting in their clinics, the small nursing homes have shut down. So the foundation of the entire healthcare system in the country has actually collapsed. And this is something which we don't understand living in the larger cities. We really don't understand this because we don't know that it is these set of people who are providing the actual healthcare, and they are the foundation for healthcare. Now, I call it a COVID obsession, and it has actually killed the healthcare foundation and has changed the fabric of the healthcare system in the country. Doctors are scared. Doctors are also human beings. Doctors are scared to contract the virus. And today we are in a stage where there are a lot of asymptomatic carriers of the virus. That is, people have the virus in them, but they're not symptomatic. They do not have any symptoms. So when he doesn't have any symptoms, he moves about normally in the community and innocently infects a lot of people all around him. So that is a very dangerous situation that we are in. Doctors realize that, and doctors are scared for themselves. And that is the reason the smaller hospitals and clinics are still shut and are finding it very difficult to open up and finding it very difficult to start operations. Mm-hmm. And the larger players, that groups like us, we've come down to 20 to 30% occupancy rates after the COVID has started. And this is rather funny. I can't really fathom this because the disease load in the community has not gone anywhere. Whether it's the heart attacks, the strokes, or the cancers, they've not gone anywhere. They are in the community. But the people are not coming forward to get treated because they believe that all the virus in the world is in the hospitals. But my reassurance to all of them is people in the hospitals, the doctors, the healthcare providers know a little more about taking care of the precautions of COVID than the common man outside. So it is actually probably safer to go to a hospital than to a restaurant or any other public place, because they know that what are the precautions to be taken. And the doctors are not just there to protect themselves. They have the responsibility of protecting the rest of the healthcare staff and the patients also. So I want to reassure everybody here that go to the hospitals, and when the situation demands, please do not hesitate to go to a hospital. I have seen and heard people dying of heart attacks. I've seen people becoming paralyzed because of strokes. I've seen people postponing treatment for cancer. That's something which is unfathomable, and it's not something which is right. And since the day we started counting the number of COVID cases in the country and the number of deaths in the country, more number of people have died because of other diseases, and more number of people have suffered from other diseases than COVID. And at the peak of COVID in China, there was a study conducted in terms of the causes of death. And at the peak of COVID was only the 40th cause of death in China. Even at the epicenter of the epidemic, it was of the 40th cause of death. So please don't be scared of it. Learn how to take the precautions. Take precautions, be safe, but don't postpone healthcare. That is something which you cannot postpone. You can postpone everything else, but not health. So as a sector, what we're looking forward to is to bring back the confidence in that single doctor run clinics and the small nursing homes. We are working with them on how to take care of themselves and how to get back to normal. And the larger hospitals like us, which have suffered tremendously because of the fear of COVID, the lockdown, and the various things that have happened post the lockdown, need a lot of policy support. But I guess that's another discussion which I don't want to go into at this point of time. And we are working with the government and listening to us, but unfortunately, they haven't come out with yet anything substantial as yet for the health sector. Now, let's look into the future of what's going to happen in terms of healthcare and COVID, and what's the future looking like. First thing is, I talked about the new normal. Your hand wash, your hand hygiene, cough etiquette, social distancing, and wearing a mask. Once you're going out of your once you wear your footwear, it must become automatic to wear your mask. These are the 4 things which will protect you from the virus, and this has to become a new normal. And it is, if you don't do it, you are going to get yourself into trouble and you're going to get others into trouble. So please get into the new normal. And then healthcare is going to become more expensive simply because of the precautions that need to be taken to both protect the patient and protect the healthcare workers from the cross infections. So the PPEs and the rest of the stuff, antiseptics and the infection control measures that are going to be taken, healthcare is going to become more expensive to deliver. But the expectation, what we see is to provide more for less. That is, people expect better clinical outcomes, better results, and want to pay lesser. That's the expectation from the industry. And we are by now used to it. But in such a scenario, and with the added condition of COVID, I think healthcare institutions will have to work on the costs and cut out a lot of costs which they were incurring in the past. All of us know, whichever sector we are in, once we do a deep dive into what's happening on the shop floor, we know that there is a lot of wastage that can be cut, and healthcare is going to get into that, has got into it, and will get into it in a big way, because this problem of delivering better care at a lower cost is not going to end today. It's going to be there for a while, and the healthcare sector would learn to deliver that and will have to deliver that at a lesser cost. Now, technology is going to play a bigger role in healthcare, both in the processes, systems, access to healthcare, in the diagnosis, in the treatment, and in the aftercare. So the entire segment of healthcare, technology is going to play a bigger role. We've already seen a huge spike in teleconsultations. People who are scared to come out and meet their doctors have started to adopt the digital platform to consult their doctors. We've been in telemedicine for years now, almost 20 years. But the number of telemedicine consults that we saw in the last 60 days did not happen in the last 20 years. That's the sort of spike teleconsultations have seen. Then telediagnostics are going up in a big way. We have telepathology, teleradiology, and multiple things. We have wearable devices where a person sitting at home can be monitored from anywhere else in the world. So wearable devices like a simple watch that you carry, your mobile phone that you carry, all these are going to add to the technology that is going to help healthcare. And home care is going to become big because of the connectivity which this technology is going to be providing. And I call it medical connectivity because it's not just looking at each other and talking or talking to each other by audio. It's actually transmission of healthcare with specific data, which is going to happen two ways. So because of this medical connectivity, a lot of home care is going to become a big thing in the country. And that's going to be made possible because of technology. Then robots are going to play a bigger role. Today we have robotic surgery, then we have robotic surgery for the heart, for any part of the body, we use a robot for the spine, for the abdomen. So robotic surgery is going to be a big thing. And COVID has introduced robots in cleaning the rooms and creating infection control mechanisms. So those robots are also into place in the hospitals. So robotics is going to play a bigger role. And we are going to get into the genetic basis of disease. So far, we were treating it at the surface, nibbling at the disease at the surface. But now with our better understanding, specifically cancers and the more dreaded diseases, with better understanding, we're going to get down to the genetic level and be able to understand the diagnosis and treatment much better. So there are going to be new models of treatment which are going to come up. And there are also going to be new payer models which are going to come up. And health sector is in a transition phase. And the phase of transition is always a difficult phase. And we are going through that phase of transition. Now, for me to summarize, I have two sets of 4 Ps in the future. 2 sets of 4 Ps. P. The first set of 4 Ps is healthcare is going to become more personalized. It's going to be more precise. It is going to be more proactive. And it is going to be more preventive. When people asked us to take care of ourselves with preventive healthcare, we never even paid any attention towards it. Now, this COVID has locked down the whole world and made everybody sit at home just to prevent that infection. So preventive healthcare is going to become a big role. And the second set of 4 Ps, which is inevitable, which whether we like or not, has to happen for healthcare to survive and for people to get a good quality of healthcare, is public-private people partnership. Public-private people partnership. So unless all the stakeholders come together and design a model and create a model which actually has a win-win situation for all the stakeholders, we're not going to be able to sustain the delivery of quality healthcare, and we're going to go backwards rather than going forwards. So I thought I'll stop there and take questions because and answer questions because that's probably what people are looking for, because that will be more relevant to them rather than me lecturing for the next half an hour or 45 minutes.
Okay.
So, Himanshu.
Yeah. So, Dr. Prasad, 2 things. One, I'll go by, because you started with the history of viruses, and you also pointed out how historically viruses have also saved the world in some way. Now, if I look at the history of Apollo hospitals, coming to this group, Apollo hospitals was the first in India to make a public issue and declare itself a corporate hospital, while other hospitals were still talking about themselves as charitable trusts, and began a chain of hospitals. And now you have almost 70 hospitals. Now, where do you go next from here?
See, even in the multiple ratios are described in terms of the healthcare needs of a community or a country. One of the yardsticks which is measured is number of doctors per 1,000 population, number of beds per 1,000 population, or number of nurses per 1,000 population. On any of these fronts, we are far, far behind the global norms, and there is a long way to go for us. One. The second thing is, most of the advanced healthcare is limited to the metros and tier 1 cities. while a majority of India lives outside the metros and tier 1 cities. So we would need to, there is a huge scope for us to expand, and there's a huge need for us to expand. But this expansion will only happen if it is sustainable. Somebody needs to pay for healthcare. Nothing comes free. Somebody has to pay. Even in the public sector, the taxpayers, it's our money which is being used to pay whatever for whatever treatment is happening in the public sector hospitals. So it needs to be sustainable, and that's where the second set of 4 P's come in, which is the public, private, and people partnerships. And when I talk about payer and affordability, one of the most important things is health insurance. When we buy a vehicle, we don't get the vehicle onto the road without a vehicle insurance. But we don't bother about health insurance because we all believe that we'll never fall sick. But at least now we know that there's a huge chance of us falling sick. And I think health insurance is something which must be made mandatory, and every individual in the country must have an health insurance. And that will make financial access to healthcare more easy. And the second aspect of it is geographic access. Once there is financial access and sustainability of healthcare on the financial side, the geographic access also will improve, and more number of hospitals will come up in tier 2, tier 3, and other areas of this thing. So there's a lot of scope for growth, and we are waiting for the right opportunity.
Okay. So in fact, we had a discussion on health insurance just a couple of weeks back, and we were talking about how it's going to expand in the days to come. Now, the government is also pushing hospitals to accept the Ayushman Bharat and Ayushman Bharat patients at low tariffs and charges. So do you think that's sustainable?
At the current rate, it is not sustainable, one. And in any other category, you can create different segments of service. But healthcare is not something which you can create different segments. If you are doing a bypass surgery, you would have to do it the same way, with the same caution, with the same outcomes, whether somebody is paying you ₹1 lakh or 5 lakhs of rupees. You may have different levels of comforts in terms of the room he's staying, but technically it's going to be the same job that is going to be done. So we do not want to land in a situation where because of the cost or the tariff, we are having to push towards using inferior quality material or compromising on certain things, which we will not do. So I think we've been talking with the government, and the government, as they were about to increase the tariffs for Ayushman Bharat, this COVID came in and we got stuck into it. But I'm sure with the current tariff, it is not sustainable. And I'm sure the government is aware of it, and they're looking at making it a win-win situation for everybody.
Okay. And what about the price controls which have been brought in private hospitals? And I'm not talking just about COVID-19, but for some other treatments as well, and in fact for some other equipment as well.
Yeah. Now, I always say this. In the past, many of the hospitals used to make their money on the margins they used to get from the products that were used for the patient. Healthcare is a service industry, and rightfully it has this thing to charge for the services that it provides. So now healthcare industry, once the prices have been capped on some of the material that's being used, have now started charging for the services that were being provided. Healthcare as a segment was shy of charging for the services, which was not the appropriate thing. Now you will see that the healthcare sector will start charging for the services, while the caps on while the products or the material that is being used will be passed down without much significant margin on it to the consumer.
Do you think something like the way the airlines industry went? So before the individual buckets started coming in, the airlines would charge you for a ticket, and then that included everything. And subsequently, we had a separate charge for the seats, a separate charge for the food, separate charge if you wanted a fast track, you wanted to get into a queue or something. Do you think something similar might happen in healthcare?
I think it's going in the reverse way. In the past, it was all open billing. It was a service provided for every service we used to charge it. But now, because of insurance, because of schemes like Ayushman Bharat, because of state schemes, a lot of the services are now becoming packaged and are becoming all-inclusive. So healthcare is going in the opposite direction. And I'm not too sure how long that will sustain, because unless the packages, because every patient doesn't behave the same way. What you and I may go through the same procedure, but our recovery would not be the same. You would recover in a different way, and I would recover in a different way, and the requirements would differ. So I think having a common package for everybody may not be sustainable unless there is a buffer created in every package to take care of those patients where the cost goes beyond the package.
Okay. Bhaskar.
Okay. Before I go to other questions from the audience, I have two questions, sir.
Yeah.
One of the reasons why Medicare has become so expensive is because the cost of training a doctor has gone up unbelievably high. Now, the answer both to the number of doctors per 1,000 people, as well as the pricing of doctors to finish the course, both need to be addressed. And the only way is to allow government hospitals to expand and take 10 times the normal capacity, because they have the FSI, they have the land, they have the patients waiting in a queue. And the doctors, your view, sir?
See, I believe a doctor, cost of training a doctor in India is the lowest in the world. It is absolutely the lowest in the world, because the government hospitals where they train, the fee is hardly anything.
Correct.
And now the government has come down heavily on the private colleges also, and has fixed a fee structure which is much lower than what it used to be in the past.
Okay.
So I don't agree that it is expensive, but I do agree with your fact that the same capacity that we have can train 4 times the number of doctors that we are training at this point of time. So we have been working with the Medical Council of India, and which was there, and now a new board is taken over to increase the number of seats, which they are taking positively. And you would have already seen multiple efforts, not just for doctors. We need nurses, we need technicians, and to provide the services that they are required. And there is a serious effort from the government towards capacity building in healthcare. And I believe that's a good move, and again, COVID has come in the way, and we'll have to wait and see how that takes shape once the government has got its hands a little free from COVID.
The second question I have is, when in 1980s, when Dr. Pratap Reddy introduced Apollo as the first corporate hospital, he had a very simple analogy that a hospital is like a hotel. In a hotel, you have restaurants. In a hospital, you have OPD patients. Okay? And the OPD patients and the room rentals had a ratio. Now, with COVID and new diseases, do you expect the OPDs to become more profitable and cash generating for hospitals, all hospitals?
No, actually, when Dr. Reddy started the hospital, he started it as a hospital only. And he tells us that when Gyani Jain Singh, the then president, inaugurated the hospital, people were whispering behind him saying that very soon this will be converted into a 5-star hotel, because there was no concept of a hospital of that size and that nature. So he still tells us that story. But anyway, coming back to COVID and its impact, I think unless the hype about COVID dies down, which it will die down over a period of time. See, a couple of years ago, we had the swine flu, if you remember, and everybody was petrified with swine flu. But it's become a normal, and it's become a seasonal thing now. And in fact, you will see that over a period of many years, dengue is killing more number of people than what COVID is killed in this year. So we have these diseases, but COVID has received a special attention because it's become a pandemic, and it's because it's getting infected. The infection is spreading very rapidly. Although 96 to 97% of the people are actually recovering, which is a very good prognostic data. You take a disease like cancer, the prognosis is very bad. You take many other diseases, the prognosis is not as good as COVID is. So once COVID becomes a normal and becomes a part of the regular disease load of the community, I think that's when the hospital will start looking up. Right now, COVID is actually pushing the hospitals in the reverse direction, unfortunately.
Okay, there's a question which is there from the audience from a Sandeep Rao. He wants to know, what is the roadmap for digitization of patient data and cross-doctor sharing across hospitals?
Yes. Now, as I said, technology is going to take over. And I already told you, teleconsultations have increased significantly. Telediagnostics are going up. And all this is going to be in the cloud. All the information is going to be in the cloud. And just give me a second.
Yes, sir.
Ma'am, I'm on a webinar. Can I call you back? Yeah. Yeah. Sure, ma'am. Yeah. So what was I had something else.
So you're talking about every data is going to be in the cloud.
Yeah. So the data is going to be in the cloud, and more and more data is going to begin as we become digitized with the new normal coming in. And as I said, technology is going to take over. The more data is going to be actually entered into the system. Once the data is going to be entered into the system, then it will be available to the, whether it's another doctor or another healthcare provider. The important thing to remember is the data belongs to the patient. And when it is in a digitized format, it has to be available to another physician or a third physician who is treating him. That is going to happen. If in our hospital, we have a PHR, personalized health record, which belongs to the patient. Patient has access to it. All the diagnostics, discharge summary is uploaded into the patient PHR, and there's a unique identification number which the patient has. And he can look up into that, and he can actually share that information with another physician outside the Apollo system also. So we are on the path towards the digitization. It's going to take a few years for that to happen, but probably COVID will push it to happen much faster.
I see. Next question, sir, is from Unnati Jadhav, who wants to know what is the level of competition in the hospital sector in India. This is more so because we expect many hotels that closed down will also convert to hospitals and nursing homes.
I mean, there is on one hand, we talk about lesser number of beds per thousand, lesser number of doctors per thousand population. And on the other hand, we talk about huge competition between the large hospitals. This is because all the hospitals are concentrated in a few cities in the country. And the affordable, and all of them are looking at the segment of people, the market, which can afford the services of these large hospitals. Now, one of the important things which I talked about was, how do we expand the segment of people which can afford good quality of healthcare, and health insurance is the answer. So once that increases, even now all the hotels converting into a hospital, even then there will be a lot of scope for further expansion of the healthcare sector.
Brilliant. So you expect that this will become a healthier sector for the health sector.
Yeah.
Okay. Then there's a question from Vipul Dalal, who wants to know whether we have reached the peak in COVID, and by when do you expect to find a solution?
See, there have been various hypotheses which have been put forward. The closest I can get to is in July sometime is going to be the peak. One. Second thing which I want to say is, we all seem to be so worried about the numbers. Today, 1,000 have gone up, 10,000 have gone up. We have crossed the 1 lakh, we've crossed the 2 lakh. I don't think that's a cause of worry. What we need to be really worried is, if we are not counting the people who actually have COVID, if we are not identifying the people who have COVID, because these are the silent spreaders in the community. Once we identify that a person has COVID, then we take the precautions. We isolate him, quarantine him, and make sure that he doesn't become a spreader. But the more number of tests we do, the more number of people we'll identify. The more number of people we identify, the more number of people we'll quarantine. So the spread becomes much lesser. So we shouldn't really get worried about the numbers. Even today, as of now, the death rate in India is only 3%, and the death rate is amongst the real high-risk population and not in the rest of the population. And fortunately, India is a young country, so I don't think the death rate is going to match any of the European or any of the other countries which we are hearing about. So I don't think we should get worried about the numbers. On the other hand, what we need to really look at is identification and taking precautions of those who are already infected.
Sir, there is an Arya Bhatt who wants to know which are the areas where quality care will improve in the hospital sector. And is it time that we had an administrator or regulator for hospitals, given the varying kinds of medical legal cases that keep on coming on?
Now, I run quite a few hospitals.
Yes.
And you would be surprised to know that we have close to 300 regulators for a hospital.
300?
Yes.
Wow.
I have to get 300 licenses, and I have a complete department within the corporate, whose job is nothing but to make sure that each of the units are compliant with all the licenses.
Oh my God.
We do not need another regulatory body to come forward. Yes, there can be a regulator body which encompasses all these 300 and brings them under a single window. That will be helpful for healthcare.
Okay.
But we don't need another one just for the sake of having another one, because that's not going to improve the quality in any way. The quality is completely self-regulated, and it is dependent on the systems and processes and the skill sets and the technology within a hospital, and how the hospital is actually operating. That's more important.
Sir, there's a doctor, Ankur Gupta, who wants to know how will doctor-patient clinical examination relationships get affected post-COVID? Many doctors are scared to look at patients. Dentists are scared.
Yeah, I agree with you that there has been a serious impact on the doctor-patient relationship in the last couple of months. And I think it will have some impact, although the doctor-patient relationship is going to be what it was in the past, because nobody can remove the touch of a doctor, because that is what a patient wants. That cannot go. But where it can be avoided, like you're a diabetic, you need a monthly blood sugar test, and you want to tell your doctor your blood sugar and take his advice, that can be done without a touch, so there a teleconsult can happen. But the touch cannot be removed from healthcare, and touch is going to be continuously there, and it is only a matter of time before it comes back to the regular routine.
But how will it come back? If a GP, I know lots of GPs who have decided to close a practice and go for telemedicine because they don't want to touch a patient.
Yeah, this is again because of the fear of the asymptomatic. Because as I said, the doctors and the medical fraternity knows a little more about the disease than anybody else. If somebody is symptomatic and is coming into my clinic, I know that he's symptomatic, so I take the adequate precautions that are required. But somebody is walking in without the symptoms, then I tend to be lax. So a lot of people are actually worried about this asymptomatic group of people. And once it becomes, as I said, COVID is going to become a part of the regular disease burden of the country. Once it becomes a regular disease burden of the country, doctors are going to take care. But I also told you that it's going to become more expensive simply because of the infection control measures that need to be taken, PPEs or chemicals or whatever stuff that need to be used. So it's going to become a new normal, but it is going to happen.
Okay. I have one more question before I pass on to Himanshu. Himanshu, 1 second more.
Sure.
Okay. There is a question where there's a person who says, well, one of there is a Niharika Pathak who wants to know, that the mental implications of such a pandemic and mental care, what do you expect to see in this area?
Actually, that's a very good question. And that is also the most neglected aspect of this whole episode. Because we all believe that going out, working is actually stress. So we all used to talk about stress at workplace, and we all used to believe that home was the place where we de-stress. But
Yes.
now it is reverse. It has become stress at home because we're not used to living at home.
Yes.
24/7 and not stepping out. And you don't know what, there's so much of ambiguity, there's so much of uncertainty. You don't know what is happening. And there's so much of news floating around, a lot of it, 99% of it being false news, wrong news. We tend to read up all this and we get into a situation where we really don't know what is happening. And a mind which doesn't know what is happening is the most dangerous mind.
Yes.
So a lot of people got into depression, and all I would like to tell all these people is, please treat COVID as another disease. Take the precautions that need to be taken, which you must take. Protect the high-risk people. Take additional precautions for the high-risk people. You may have parents, elderly people, or immunocompromised people at home. Please take additional precautions and let everything else be normal.
Excellent.
That is the way you need to look at it, and that's the way you're going to get out of this situation.
Excellent. Good advice. Himanshu.
Yeah.
Yeah,
I know that we're running short on time, but Dr. Prasad, I had this question that came out of what you said about digitization. So when you talk about digitization and if hospitals would have data of all the patients, not questions arise. You said that the data belongs to the patients. But at the same time, during the times of pandemics such as this, the government may want access to that data. Now, how do you resolve that dichotomy?
No, the government has enacted the Epidemic Act. And as per the Epidemic Act, there are notifiable diseases. Even before COVID, they were notifiable, like dengue is a notifiable disease. Tuberculosis is a notifiable disease. As per law, we are supposed to notify the government about the people who are having this disease. So we are supposed to give them the data because the government has a responsibility of following up and preventing the spread of the disease. So they enacted that law. So as per that law, whichever is a notifiable disease or whichever is notified as an epidemic or whenever this an act is put into place, we have the responsibility of sharing the data, relevant data with the government of India.
And that obviously then brings me to the next part of it. Data security is going to become a big thing.
Oh, yes.
Because there are so many places from where this data can go out from a hospital, or
absolutely,
given that it's going to be a behemoth of hospitals.
Absolutely. We are all the time on the lookout. As we get digitized, there is always an increasing threat of security. And this is for multiple reasons. On the lighter side, you have a celebrity admitted in the hospital, and the celebrity doesn't want to know the people to know what's happening with him or her, but the people want to know, and that the easiest way to do it is to hack the system and get the information out of the hospital. That's on the lighter side, but there is a lot of importance to this data which is collected in terms of research, in terms of innovation, in terms of new molecule discovery, in terms of validating new products which are coming out. So there's a lot of value to this data which can be brought out from the hospitals. So that could be another reason why people are at all the time looking for data from the hospitals, and that cybersecurity is a big thing for us, and we are into it big time.
Just one little question, Himanshu. Taking on what you said, there's a writer whom I like very much, Noam Hariri, who talks about 21 ideas for the 21st century, who says, today you have so much of data about a person, such a lot of computing, when you put both together, you know more about a person than the person knows about himself.
Absolutely.
Given this combination of huge data and huge computing, governments can control people, making a mockery of so-called democracies.
No, I hope the government uses this data to control the diseases rather than anything else.
Because Hariri's biggest fear is the misuse of data by governments using huge computing. And I admire Hariri for his perception.
Yeah, but in an epidemic like this, I guess data
There's no avoiding it, yes.
There's no avoiding, no question of avoiding.
Okay, Himanshu, back to you.
Great. So thank you so much, Dr. Prasad. It was such a pleasure. And to me, the biggest takeaway was that advice that you gave, because it is so pertinent, and especially for an institution like ours, the Indian Institute of Management Indore, which has the highest number of students in it. All my students who are in their homes locked down the past 90 days or so, and the kind of the mental health issues that may come in because of, as you said, the ambiguity and the whole point that nobody knows what's going to happen next, not just in terms of their movement, but also in terms of careers, in terms of education, so on and so forth. So those words were very reassuring that everyone, including, of course, the students, should understand that it's no point being on the edge. We have to acknowledge and accept that this is going to stay with us, provided we take those 4 precautions that you spoke about. And also, I love the part about the public-private people partnership. And the concept of Atmanirbharta that the Prime Minister spoke about will also require the participation of the people. Because we have to, first of all, make sure that we take care of ourselves. Because otherwise, if this is not done, nobody in the world can actually help. I mean, the age-old adage that God helps those who help themselves. I think those words are far more truer today than they were at any other point of time. So thank you very much, Dr. Prasad. It was a pleasure. It has been a pleasure working with you. Like I was telling Bhaskar on the exit policy for Madhya Pradesh MSMEs. And once again, it was a pleasure talking to you here.
It was
Thank you so much.
incredible.
It's been a privilege. It's been a privilege. Thank you so much.
Thank you so much.
Thank you very much.
Thank you to all our viewers who have been watching this. And I'm sure there was a lot that you have taken from this particular talk.
And do come back next week.
Absolutely. We'll see you again on the same day at the same time. Please take care of yourselves and your families and all of those who are around you and who cannot take care of themselves.
Doctor, thank you once again.
Thank you so much. It's been a privilege. Wonderful. Bye-bye.
Thank you.